Okay, well, I'm here today with Senators Lujan and Welch, and Lisa Blunt Rochester is on her way. She's voting. Okay, well, we're here. Why are we here? The country is standing on the edge of a health care cliff, a cliff Republicans are pushing us towards, and the clock is almost out. 27 days. That's all the time Americans have before ACA premiums expire and health care costs explode in every state, city, and locality of the country. The Senate Republicans can avoid this now. The Senate can vote to pass our legislation, plain and simple, and save American thousands. Republicans caused this problem. They knew this cliff was coming and would only make the pain worse for Americans, yet they've chosen to do nothing, absolutely nothing. They are nowhere. They don't even have a proposal. And the American people are running out of time. So today I'm announcing that Senate Democrats will introduce legislation for a 3-year clean extension of the current ACA tax credits. This bill, a clean year 3 extension of the ACA tax credits that Democrats will bring to the floor for a vote on Thursday, and every single Democrat will support it. Every single Democrat. That means Republicans have only 1 week to decide where they stand. Are they going to vote for this bill and bring health care costs down for the American people, or block this bill and send premiums skyrocketing on January the 1st? That's what's at stake. This is one of the most important votes we're going to have in this whole Congress, because right now Republicans, even a small number of them, 7 of them, could vote yes and avoid the health care cliff that so many Americans are so worried about, that millions of American families are staying up and can't sleep at night because they don't know what they're going to do. Republicans have no plan to deal with this crisis. No plan. And make no mistake, the vote is the last chance before January 1st to avoid the crisis they caused and bring relief to the American people. They have no unity. They have no consensus. They don't even have concepts. You got one Republican saying this, another Republican saying that. It's amazing. They have nothing in the most major issue affecting the American people, and they can't get their act together. Democrats are fighting to lower health care costs. Republicans are fighting with one another. They're so busy fighting one another that they're not helping the American people. For months, they spent their energy trying to kick low-income families off their coverage, pushing poison pills that ban abortion, floating one-time checks that wouldn't even cover a single month of premiums, let alone 12 months. And families, as we know, are paying more. Republicans want to hand them the few Republicans who have this payment plan want to hand them a Band-Aid while premiums jump $1,000, $2,000, $5,000 a month. So, a one-time check's not health care. It won't stop January's premium shock. If Republicans block our bill, there's no do-over. Premiums go up January 1st, period, and the premiums are like a hammer blow to the American people. You all know the numbers. Couples nearing retirement making $85,000 a year could pay $30,000 more in states like Maine, Alaska, Montana, and Tennessee. 24 million Americans will see their premiums double. Americans living with chronic illness will suffer. Real communities will be devastated. Even families with employer coverage. They say, well, I'm covered by my employer. Ask your friends who work for companies like that. They're already getting notice of higher bills because it's affecting everybody. So, Senate Democrats are united. We're clear-eyed about the consequences. We are ready to vote. Senator Lujan.
Thank you, sir. Thank you, Leader. Well, it's good to see everyone here today, and I want to thank Leader Schumer for bringing us together. Look, this is about affordability. What Republicans are doing right now is they really don't give a damn how expensive healthcare is going to be for the American people. Plain and simple. Republicans had an opportunity to work with Democrats to get real legislation, real policy included that would extend these tax credits to make healthcare more affordable for millions of people across the country. They chose not to. And it's no surprise, Republicans for the last, 10 years or more, have voted over 70 times to get rid of the Affordable Care Act, to repeal it. You all remember their calling call, we're going to repeal and replace. And that wasn't so popular with the American people on polling, so Republicans, they just said they were going to repeal first, right? And then it was repeal and replace. Well, they never did it. What does that mean to folks? President Trump brought junk plans back, making it okay for the American people to buy some insurance plan, even if they had some chronic disease like cancer, to buy insurance that covers everything but the cancer. One gimmick after another, making things more expensive to the American people. And as Leader Schumer said, look, this isn't just about people across the country that are going to benefit from these tax credits directly. This is going, if Republicans don't come to the table to extend these tax credits, we all know that insurance is getting more expensive for everyone, including everyone in this room. This is impacting the entire market. Some constituents over Thanksgiving chatted with me that they were excited to read that they were going to get a cost of living adjustment in their Social Security, and then they got sticker shock when the Medicare cost came, and it ate up what they saw with the COLA and some. Over Thanksgiving, people were getting an idea of what health insurance was going to cost. More sticker shock. They were back at the desk on Monday trying to figure things out if they were going to be able to afford it. It's one problem after another. And then to boot, in the big, beautiful bill, Republicans cut all of the federal tax dollars with Medicaid. There's rural health clinics across the country that already announced that they're going to be closing. I mean, this is just one kick in the face after another that Republicans are delivering. I'm going to close with this. You all know that I've been chatting about it more and more and more about that stroke that I survived 3 years ago. I don't know how many of you have been in a hospital bed worrying about getting better. But when you're sick and you might die, all you should be worried about is getting better. Not what happens if you're going to lose your house because you can't afford the damn bill that's going to come after you get better, if you're fortunate to. This is absolutely wrong for Republicans to be lying to the American people and not stepping forward. If they want to come up with reforms, put them on the table. They've had time. Let's get these things extended. The bill that Leader Schumer's talking about has Republican support in the House. They've introduced their own bill. There's support to get this done and get it to the president. I hope and I pray that my Republican colleagues will do the right thing. There's no reason that they can't join us. Get this done. Do it on a voice vote, for God's sakes. Get this done. Tell the American people before Christmas, you're going to be okay. We care about you. We're not going to kick you in the face one more time. With that, I'm going to turn it over to my friend from Vermont, Peter Welch.
Thank you very much. You know, we have a healthcare crisis in this country. This country pays the most and gets the least. Literally, we pay about 2 times more than like European countries or Canada, and our healthcare outcomes are not as good, which is not to say we don't have great care, but it is getting unaffordable. We've got a calendar that is relentlessly ticking away, and unless we extend these tax credits so that people can continue to have the same health care in 2026 that they had in 2025, 24 million Americans are in jeopardy. Leader Schumer brought the Democrats together. We felt it was our responsibility to put a concrete plan on the table that would make certain that Americans across the country did not lose their health care. And Chuck, thank you, because we have 47 votes. We need 13 more. The key to that is going to be whether President Trump wants to engage and bring the parties together to extend these credits. The aspect of this that I find very sad is that the people who are going to suffer are people who are represented by Democrats and by Republicans. It just doesn't matter. These are folks, families, farmers, they need health care. You know, I got a call from a farmer in the Northeast Kingdom of Vermont. He's a Trump voter. But he said, Peter, I'm paying $900 a month for health care. And if we lose these tax credits, my health care is going to go up to $3,200. And he says, you don't have to worry about me anymore because my family's dropping health care. Well, I do care about him. We all care about him. And that's why Leader Schumer brought the Democrats together to put on the table a concrete plan. We don't have anything in response. And, you know, we often get in the blame game around here, but the one group that cannot be blamed are the Americans who are going to be losing their health care. They have no power to address this. So the Schumer plan here is a concrete proposal that would give security to folks in Vermont, and I'm going to be going to Nebraska and Iowa in my capacity as the ranking member of the Rural Subcommittee on Rural America and the Ag Committee. But I'm going to be talking to farmers out there who are going to be saying the same thing as that Northeast Kingdom farmer said to me. We want to protect the health care that families in this country have. And that includes Republicans, it includes Democrats, it includes independents. So we've got a concrete plan. We've had no response. And that means we're just going to abandon families and businesses and Americans who are going to lose in 2026 what they had in 2025. We got to pass this bill.
Thank you, Peter.
Thank you.
That'll be all
I
right.
turn it over to Lisa Blunt Rochester.
Thank
my
you.
colleague.
Thank you. First, thank you, Leader Schumer, for inviting me to participate. It's really good to be here with two senators who I had the honor of serving with on the Energy and Commerce Committee in the House. We did a lot of good work on prescription drugs, health disparities, and a whole host of other issues. And as I stand here, I'm literally thinking and watching the clock in front of me tick. The clock is ticking. Time is running out. There is a sense of urgency for those of us who are standing up here. And so I know the leader would say he doesn't consider this his plan. He considers this the American plan, right, that we do something. And I will tell you, as was said by my colleagues, I come from the state of Delaware. And anyone who knows Delaware knows that we are urban, suburban, rural, and coastal. We have farmers. We have small businesses. We have environmental justice communities that are impacted, even by CAFE standards. And so I will tell you, yesterday, when I was looking at my television and seeing our Republican colleagues at the White House, what I thought they were announcing was a healthcare plan. I was shocked that what they were announcing was something that would make us less healthy. And so as I stand here today, I think about the years of my work in this space of health. I served as Deputy Secretary of Health and Social Services in Delaware and got to see the impact of health care. I served as head of state personnel, so I saw health care from an employer perspective and how much it costs and how do you keep people healthy. I served as CEO of the Urban League, so I got to see health disparities and how in this country, as rich as we are, we have one of the highest maternal mortality rates in the world. So health care to me is a basic necessity. It's what drove me to run in 2016 and what I fought for. And times it's sort of like history is repeating itself or rhyming. Because I came in, Donald Trump was president. Republicans had the House and the Senate. And as was said, there were calls for repealing and replacing the Affordable Care Act. What we recognize is that the Affordable Care Act is not perfect. But one thing I do know is that that family who has somebody with a pre-existing condition like asthma or diabetes is grateful. That parent who has a kid who's 22 or 23 is grateful. And so what we're saying here is very simple. We have an immediate problem, an immediate crisis, an immediate cliff, and we need to take immediate action. And that's why we're proposing the 3-year time frame to allow us to also work with our Republican colleagues to make the substantial changes that we need to make us a healthier country and to make sure that we have a healthcare system that's working for all of us. I came up here with a whole bunch of notes and really didn't use any of them because it's really that basic. It's really that simple. We're proposing something that will help right now while we also give time to work together. I have stories of Delawareans, as my colleagues do, small business owners, rideshare drivers, young people who are concerned. For the first time, I had a resource fair. For the first time, people were lined up hugging me, saying, please help us. Please. And so we stand up here on behalf of the hardworking families. And we also stand up here to say, for anyone, including the president, to say that this is a Democratic hoax. Right now, people are looking in their email and in their mailboxes, and they have the receipts. It's happening now. And we need to act now. And so I thank you, Leader Schumer, for your leadership. I'm fortunate that I had the opportunity to also work with Senator Wyden on legislation, the Protecting Patients and Affordable Care Act, that focuses on not just the 3 years, but it is in tandem with this to make sure that some of the harmful things that were already done this year through the Big Beautiful Bill and through regulation are pulled back so that people, again, don't fall off a cliff and that we're making sure that they're able to navigate this system. Again, I'm glad to be standing here before you, but I'll be happier when we pass this legislation. Thank you, and I yield back.
Thank you. Questions on this subject? Yes.
Good afternoon, thank you. Are you concerned that the Republicans, have this idea that Obamacare was the fault of the Democrats, that there's problems with Obamacare, that's why it needs this subsidy? 3 of the 4 of you voted for this in either the House or the Senate before, and that therefore they rely on that as a crutch to say, oh, this shows why Obamacare is broken, and therefore we don't have to do anything.
Shows you how out of touch they are. 55% of people who voted for Trump in November of 2024 support extending the credits. 55% of Trump voters. The Republicans are so much in a bubble. They're so out of touch. They don't understand the anguish and concern of the American people. Yes.
Could I add one thing to that, Chair?
Sure, sure.
I also want to remind us that the disproportionate amount of people who are impacted by these tax credits not going into place are from red states.
Yep. Right.
Many of those states didn't expand
look at them
Medicaid. And that's why many of them are the ones that are going to be impacted. So this isn't a Democratic thing. This is an American problem right now.
It's overwhelmingly supported by people at all parties, including Trump voters. Yes.
And over the last couple of days, there are a number of House Democrats that have presented framework, both bipartisan and the New Dems. Have you had conversations with House leadership about getting everyone on board in the House? I know you said that Democrats in the
The bottom line is the first thing that has to happen is to avoid the calamity that's going to happen is the 13 Republicans need to vote with us on this bill. As for whatever House proposals there are, we'll always look at something. But I don't even see 15 Republicans supporting it right now. You have the Republicans having no plan, no unity. They're busy fighting with each other. Sure, an individual or 2 or 3 people can say this or that. It's not going to solve the problem. Yes.
You have talked about Trump being the key to all of this, and in the past have said that you would call him when the time is right. Do Do you think maybe the time now calls for a direct phone call to President Trump?
Trump calls this a hoax. What Trump ought to do is talk to the Republican senators and say, vote for this proposal. That's the way to solve the problem. That's just about the only way to solve the problem before the January 1st deadline. Then, I mean, look at it. They don't even have a plan. They don't even have two plans they're divided about. They're all over the lot saying many different things, fighting with each other. It's crazy. It's just crazy on such an important issue that they would have that. Yes.
This bill obviously can't get the 60 votes to overcome a filibuster. Let's not pretend it can. But I understand Republicans don't have a plan, but why not propose something that has some of the tweaks Republicans could ask for? There are at least like 5 to 6 Republicans who said they would vote for an extension with an income cap, with
Well,
the
they haven't.
eliminates the $0
Okay.
premium.
Ask them what they want to do on Hyde, those 5 or 6 Republicans. Yes.
Senator, why did the bipartisan talks to negotiate a compromise bill fail, in your view?
Well, you can talk to the bipartisan people who were talking, but in the views of the Democrats I've talked to, the Republicans never had a plan that could be even close to acceptable, and they were unwilling to deal with Hyde. I mean, Peter was part of those. Go ahead.
Yeah, I mean, the bottom line is they couldn't put pen to paper. They couldn't propose something that was concrete, where they could say, we've got 4 votes or 5 votes or 6 votes. So it was aspirational discussion, but it never got concrete. So what really was the reality is that there was never an engaged discussion about how to extend these tax credits with specifics offered.
Plain and simple. Yes.
Try and bring all this together in 2 questions, but to follow up, why not ask for that kind of meeting now, as you're saying the clock is ticking, and then 2, I'm still not sure I understand why you're putting this offer on the table, which is a non-starter for so many Republicans.
Okay.
There's something closer that could get through the finish line.
It is not a non-starter. 13 votes could solve the problem. That's where the onus should be. Putting something together, putting something together that 2 Republicans might support when Johnson says he's not going to do anything, when half his caucus doesn't even want to repeal the ACA tax credits. Come on. Come on. The fault is there, not with us. And they can just vote for this, plain and simple. That's it. This subject. Yeah, go ahead, Peter.
Well, I was just going to add, the only way you make progress is you get concrete. What we are proposing is concrete. It might not be the way some of the Republicans want to solve the problem, but they are not being concrete. And the clock is ticking, as Lisa was saying. So this is a good faith proposal. It doesn't mean that Senator Schumer would negotiate on our behalf if there was a concrete counter proposal that was made. But the Republicans really have been AWOL, and the president's been AWOL.
You can't find even 30 or 50 Republicans in the House, even 10 or 12 in the Senate, who say they agree on something.
Right.
So come on, it's ridiculous. Yes.
Thank you, Mr. Leader. If you don't get these 13 Republican votes that you're seeking and these subsidies expire, will you continue to push for a legislative fix, or does this simply become a message?
Look, we're always willing to talk. We're always willing to talk to people who want to lower people's health care costs. So far, there's no one to talk to. Thank you, everybody.
Thank you.
Look, just one last thing on
Go ahead,
that.
Henry.
You all have reported on all the House Republicans while they were home on vacation for, 90 days, 120 days, however long Speaker Johnson kept them at home. Dozens of them went to the camera and said that we need to extend these tax credits. You all have reported on them. You know the votes exist. You know this.
In the House.
Well, do they want to do a 1-year, a 2-year, or 3-year? Put it in.
Actually,
Liz, look,
but actually.
Ms. Stefanik, who's running for governor, has been one of the folks that's been bullying Speaker Johnson. Thank God for that recently, for having the courage to do that and showing some backbone. I appreciate that. And she's told them 1, 2 years. There's others that have said 3 years. Some have said 1, some have said 2.
You know, the reason
Chad?
everyone's so excited here, excuse me, is because they have no plan, they have no unity, they have nothing, and you're saying, why don't Democrats do something? We are doing something. We're doing the quickest, easiest, simplest way to take the burden off the backs of the American people, and they ought to vote for it.
For a compromise, a year and a half, a year, I mean, that's what.
First, they got to vote for this. We can talk about things down the road. This is the only solution to avoid the January 1st cliff, plain and simple.
Chad, you know all the Republicans, man. Show me something.
Yeah,
You know
show
them.
us,
You know
show
them
us
best.
a group of them.
You know them best.
There was a
Pull them
group-
in.
Listen, to respond, there was a group of them this morning, a bipartisan group of more than 20 members, including at least the 10 or a dozen
In the House?
Republicans in the
Then
House.
Speaker Johnson should give them a vote.
It's
Send it
not
over.
A one-year
Well,
extension.
have
that
Speaker-
that they're putting on the table.
Speaker
They-
Johnson should give them a vote.
What did
and
they
send
say
it
about
over.
Hyde? Did you ask them? Is Hyde in it or not in it? Ask them.
Framework they had to know.
I
Thanks,
think
everybody.
you correct-
Yeah.
Thank you, folks.
Well, look, why doesn't